Hi everyone, my name is Michaela Andralis and I'm here to talk to you guys about CBD, its potential role in exercise recovery and inflammation management. There are a couple of objectives that I want to cover today. The first being evaluating the mechanism. What does this mean? We want to kind of identify how CBD works and kind of reducing that post-exercise inflammation, specifically some muscle damage markers. The second objective is we want to cover comparing the recovery outcomes after use, including that muscle soreness, pain levels, and muscle inflammation. The third objective is we want to kind of look at the optimal usage and safety. We want to see if there are ways that we can provide evidence-based guidelines for integrating CBD into recovery protocols. I want to give a bit of a background on CBD. So CBD stands for cannabidiol. It's being reviewed as a promising adjunctive therapy for various conditions, and that's really the purpose, to kind of understand how we can incorporate CBD in our protocols. And we know that patients, healthcare practitioners, and scientists are interested in CBD's potential. We want to know if it works. We want to see how we can integrate it in patient care. So we want to determine its effectiveness in exercise recovery, and we want to see if that we can optimize therapeutic strategies. There are 5 major CBD targets, in which the first one hits the CB1 and CB2 receptors. And how this works is through FAW, in which FAW gets inhibited, and then that can in turn reduce pain signaling. What's nice about this is that there isn't any psychoactive effects, and being the fact that CBD is a negative allosteric modulator, this in turn can reduce pro-inflammatory cytokines. And the second major target is the activation of TRP channels. So TRP channels are leading to pain sensation. So once this gets activated, it actually leads to that desensitization, and you get that reduced pain perception, which is pretty cool in the fact that it could potentially alleviate some muscle soreness and inflammation. The third target that CBD potentially interacts with is the serotonin receptor, in which when it hits that serotonin receptor, it could provide anti-anxiety and anti-nociceptive effects. The fourth target is it could potentially have anti-inflammatory actions, in which we get that increase of anandamide, which in return ends up reducing the production of pro-inflammatory cytokines, specifically TNF alpha, interleukin 6, and interleukin 10. The fifth target is the activation of GABA, in which GABA is an inhibitory neurotransmitter. And when we get that increase in GABA activity, that in turn will reduce muscle rigidity. And because you have that reduction in muscle rigidity, we end up having a reduction in pain perception. And this is interesting to know that it could potentially interact with the transmitting of pain signals. So this was the aim of my study, in which I used the PICO method, and what that entails is that the population that I wanted to look at was athletes and physically active individuals. We wanted to focus on that because I wanted to determine whether CBD would reduce pro-inflammatory cytokines and help with post-exercise recovery. So my intervention would be CBD or cannabidiol, and I didn't want to compare it to anything besides a placebo or no intervention at all. And our outcome would be to see if there was any improvement in these recovery metrics. So what are some of my methods? I wanted to identify relevant studies, and the 3 main databases that helped me do this is I used PubMed, SciFinder, and Embase. I wanted to limit it to only peer-reviewed articles and only in English from January 2010 to September 2024, and this was really to ensure that this was the most relevant evidence. It could really identify the metrics that I was looking at and make sure that it also included athletes. So these are my mesh terms, and this is what really helped me identify the articles that strictly had to deal with inflammation, the post-exercise inflammation, and with athletes. So for my inclusion criteria, I wanted to ensure that I was only focusing on studies that had human participants. I only wanted to focus on randomized controlled studies, cohort studies, and I kind of knocked out anything that had to do with self-reported studies or observational studies. And my exclusion criteria, I wanted to obviously focus on athletes. So I didn't want any non-athletes or non-exercising individuals. And the biggest point was that I focused on studies that only had CBD effects. So if any studies focused on THC without isolating that CBD effect, I didn't include it in my research. After my initial search results, I had about 207 articles, but I only wanted to focus on articles that were randomized controlled trials, systematic reviews, and meta-analyses. I didn't want anything that was self-reported. So after doing that, I had about 170 articles, but I needed to screen their titles and their abstracts. And unfortunately, after screening them, I realized it didn't really have much to do with CBD. And after screening that, I had about 58, in which I looked at the articles, I read the full text, and I determined that there wasn't a clear cause and effect. It didn't have any dosage information, and I didn't have a measurable outcome from those articles. And because of that, I only ended with 12 articles. And I also eliminated any animal studies, in vitro studies, and I wanted to strictly focus on humans. So ended up with about 12 in the end. So I put my studies in a table. And what this table is showing is it starts from the lowest CBD dose that I found, and it goes by increasing dosage by each row. And I highlighted them in green to show the ones that had a positive outcome from using CBD, and the ones that are in red are the negative outcomes. So we didn't see a difference on those athletes or those exercising individuals to see that CBD worked on them. And what I really want to show is over these next two slides, we see here that as the doses increase, unfortunately, we're not seeing much difference in CBD being positive. So definitely alternates in studies where CBD does have a positive effect at some doses, but as the doses increase, we're not really seeing a significance in our results. And what I specifically want to point out is we had one study on the last slide that was a topical, and on this slide we have this topical at 1,000 milligrams, and unfortunately for both of these, we saw that there was no significant effect, and we didn't have a reduction in these measurements that we want. So I think it's important to note that these creams or these ointments, the only two studies I was able to conclude any measurable outcome from, unfortunately did not have any effect. This slide, I want to mention a little bit about how there was a clinical measurement of soreness reduction. So there are three ways that can produce a measurable outcome in which we can determine pain or muscle soreness. So the first scale is called the visual analog scale, in which it is measured from 0 to 100 millimeters. 0 is at one end of the line, which on the left-hand side, and you have 100 millimeters on the right end of the line, in which the athlete or the exercising participant will end up putting a dot on the line as to where they measure their soreness. And however far that dot is from the 0 will determine their level of soreness. The next measurable outcome is they kind of use these DOMS questionnaires, in which this can assess soreness in specific muscles. Specifically, I want to note that it's commonly used to evaluate soreness that occurs 24 to 48 hours post-exercise. And lastly, the third one is self-reported pain scores. However, this tends to be, you have to take it with a grain of salt given the fact that this is self-reported. It could add some bias, and additionally, we need to ensure that we're having objective measures and not necessarily subjective. I created this graph based on the 12 studies that I had in the end, in which I put them in increasing CBD dose on the x-axis, and on the y-axis, there is the population size. So that is the amount of participants that I found across all of the studies and according by dose. For example, at the 16.67 milligram, there was about 12 participants, and that's why you see this here for the population of 12. So what these colors mean is the yellow means that some participants end up ended up getting worse at that CBD dose. And you have at the blue, you have improvement at that CBD dose, where we can see in the red, it signifies that it was non-significant. So unfortunately, across the x-axis, as we see these doses increase, we're not seeing a significant measure of how CBD can help our outcomes. And it's interesting to note that the majority of this graph, unfortunately, is non-significance. I created this graph here in which we see that the CBD dose is on the x-axis and we have the percentage change in VAS on the y-axis. So VAS, as a quick reminder, is the visual analog scale in which they use that scale to determine pain levels. And one thing to note is that at the 16.67 milligram sublingual oil, we see that there is a statistically significant decrease in pain levels compared to the placebo group. So as these doses increase on the x-axis, we're not seeing any significance compared to the placebo treatments, unfortunately, in these decrease in pain levels. It's also interesting to note that as the doses increase, we see here at the 10 milligram per kilogram capsule and the 1,000 milligram ointment that there is an increase in pain levels. Although it wasn't statistically significant from the placebo treatment group, it is interesting to note that THC does decrease pain threshold. Unfortunately, there isn't enough information for us to determine whether that is the same thing that CBD could do. I wanted to give a bit of a background on muscle recovery. So anyone that is exercising or is an athlete, there's exercise-induced changes that happen in our body. And during intense exercise, we end up having this increase in pro-inflammatory cytokines. So I mentioned interleukin 6, interleukin 10, and TNF alpha that we're going to be focusing on. So these tend to elevate within 48 hours. They also decrease within 48 and usually normalize within 1 week. But because of these exercise-induced changes, it's normal to have muscle inflammation and increased creatine kinase levels. But we want to note that there's variation in baseline levels. So depending on the sport or the exercise, there will be a difference in these pro-inflammatory cytokines. There will be a difference in creatine kinase levels and myoglobin levels. And we have to note that running, strength training, and basketball cause these varying levels. And it's harder to generalize its effectiveness across activities. And we want to know that the duration of recovery is also different, where the duration of CK and cytokines stay elevated across these activities. Specifically, it could be longer in runners, shorter in strength trainers, and because of these discrepancies, we really need to figure out how to measure CBD recovery and inflammation. I created this graph to show the change in myoglobin and the change in creatine kinase. So this is to determine the muscle damage and muscle injury in these athletes or exercising participants. So we have on the x-axis, we have increasing dose again, where we have a 60 milligram micelle encapsulated formulation, 60 milligram oil, and 5 milligrams per kilogram capsule, and a 300 milligram capsule. On the y-axis, I have the percentage change of muscle damage. And a couple things to note is that at the 60 milligram micelle encapsulated formulation, there ends up being statistical significance from the placebo treatment, in which we see a percentage change in myoglobin and creatine kinase. It has actually decreased in these participants. Specifically, the 60 milligram oil in the myoglobin percentage was also statistically significant from the placebo group. I want to point out that AD for this study specifically, they looked at advanced athletes and highly advanced athletes, and that's what the HI stands for, and the AD is for those advanced athletes. And specifically at that 60 milligram micelle encapsulated formulation, we see a statistical significance from the placebo treatment. However, this wasn't a decrease in percentage change in myoglobin and creatine kinase. This was actually an increase in which they had more muscle injury. And that is an interesting thing to note, because trying to determine why there could be an increase in some but a decrease in others. And unfortunately, at the 300 milligram capsule, there was actually no percentage change, in which the treatment group with CBD and the placebo group had no difference between their myoglobin and their creatine kinase. This third graph that I want to cover is, I have increasing dose again on CBD on the x-axis, and on the y-axis, we have the percentage change in those inflammatory biomarkers. Unfortunately, at every single dose, there was no statistical significance from the placebo group. So there was essentially no difference in that reduction of pro-inflammatory cytokines with that CBD treatment, regardless of dose. Also interesting to note again, at the 300 milligram, that there was essentially absolutely no difference. So even though there is some reduction and some increase, it wasn't significant. I created this summary table to kind of show the three objectives that we wanted to cover. So we wanted to cover muscle soreness, we wanted to cover the inflammatory cytokines, and we wanted to cover TK and myoglobin for that muscle injury. So on the left-hand side, we have it tabulated by dosages. So according to the low doses, the biggest thing and the biggest takeaway that I want you guys to take from these studies was that there wasn't really any difference, unfortunately, on the muscle recovery, inflammation, and the pain levels. There was just some statistical significance from the placebo group when it came to the sublingual oil formulation and at the 16.67, but overall, unfortunately, it was pretty negative in the fact that CBD didn't really affect any of these measures that we wanted to look at. So why CBD? We know that we need more evidence. There's not enough studies out there. We cannot make an informed decision about dosages. We cannot make an informed decision about formulation recommendations. On the slides before, I showed that there was unfortunately no significance. But we know that CBD appears to be safer than opioids to treat pain. It has less drowsiness, and it is safer in overdose, which is a positive, but there wasn't enough results to kind of help us with that. And CBD also could be an alternative to NSAIDs, which are commonly used for pain and inflammation, but unfortunately come with side effects like gastrointestinal and renal complications. I created this pie chart here, and the way that I came up with these percentages was, I looked at all of my studies, I calculated all of the participants, and that was my denominator, and my numerator was how many out of these studies experienced these specific side effects. So as the most common side effect, we got nausea. The second common was dizziness and headache. And we do know that CBD has side effects of drowsiness, dizziness, and gastrointestinal. A lot of patients end up having stomach issues or end up experiencing diarrhea. So it goes in line with what we already know from reported side effects. But what's interesting to note is that this mild pain, and it's hard to note from these studies because there wasn't enough information to know whether it was pain caused from CBD or simply pain caused from the exercise. So overall, what did we find out? So we know that we wanted to look at pain, muscle recovery, and inflammation. But unfortunately for pain and muscle recovery, as doses increased, there was no change seen in those pain levels or muscle recovery. And for inflammation, absolutely no dose had that reduction in those inflammatory cytokines. Even though we see some doses being statistically significant, it could be due to formulation in which it was a sublingual oil or the micelle encapsulated formulation. And hopefully in the future, more studies can investigate those specific formulations and determine whether it is the formulation or figure out why that those specific dosages worked. But according to the rest of the dosages, it just was not significant compared to the placebo group to make that informed recommendation for those athletes or exercising individuals. So just like any study, it comes with research gaps, and there's quite a few in my literature review that I wanted to note out, with the biggest being standardized dosing regimens. There's a lack of consistency in dosages and forms. Noted on a lot of my graphs, we see the diverse range going from as low as 16.67 milligrams all the way up to 1,000 milligrams, where in between you're kind of getting 300, 2 mg per kg, and there's just not enough dosages being tested for us to give that recommendation on which CBD dose would be effective. So we kind of need to come up with a consensus on optimal dosing strategies, and that's really through doing more studies and using a diverse range of that CBD dose. There's unfortunately also it's a very limited diverse population in the aspect that there are way more males than females in the studies. Some studies had up to 25 male participants or 40 male participants to a ratio of females less than 10, and that really limits the generalizability of the study. We also need long-term safety data, in which we don't really know much about CBD and its potential drug interactions, which also comes with issues of how do we really know whether it could be efficacious or whether it's going to interact with something, and objective outcome measures. There's kind of an over reliance on subjective measures of recovery and pain, but we wish that there was a way that we can come up with more objective biomarkers rather than self-reported pain measures. And we need to have more understanding on CBD's mechanism of action. Yeah, there are studies that kind of tell us how it could work on the molecular level, but we're still trying to figure that out. So these next two slides are just my references that I used. We're doing this study here at USC with recreational athletes, in which we want to know, do you work out? How do you think CBD use impacts your workouts? Please let us know in this survey. We would love it if you would forward it out to anyone that has some thoughts on CBD. It would be greatly appreciated. I also would love to know your guys' feedback. I would love to know your thoughts on the presentation, how you think it went, and kind of your thoughts on CBD in general. So if you can, just please go ahead and scan those two QR codes. We would love that. Thank you so much for your time. Have a good one.